It is cool, a little overcast today. It's very nice, but we know the summer in Kansas City is far from over. We still have a risk of heat again and heat-related illness and injury that come along with that. So here with us now, Dr. Denise Miller of Lee Summit Medical Center. We're going to thank you for stopping by.
Sure.
Especially in this busy season for you. You said you have seen almost a record number of heat-related cases.
I have seen more this year, since we're in the middle of summer, and I've seen more this year than I have probably for the last 3 summers.
Okay, that shocks me because this summer it hasn't seemed so extreme.
One of the things is the days that we have that are hot, the humidity is so high. So there's 2 components. It's not only the temperature, but it's also the humidity in the air, and that makes up your heat index. When the humidity is greater than 60%, you can't sweat. Your body doesn't evaporate sweat like it's supposed to, which is our main way of losing heat.
Okay.
And so you start retaining heat, or you're sweating a lot and you can't keep up, and you wind up getting heat exhaustion or heat stroke. We've seen quite a few.
Okay, so let's go into in depth what those 2 things really mean, the difference between heat exhaustion, heat stroke. But first, tell me what types of cases, what kinds of people are coming into you? What are they saying?
Well, a lot of times it's people that have been out in the heat and can't get away. So construction workers or guys that are working on the highway. They don't have the opportunity to get into the air conditioning or get into shade. They're working hard. Right, and they're not keeping up on their fluids, which is very important. They're losing electrolytes. So an example would be somebody coming in with confusion, having muscle cramps. I had a case, wife said he's just not acting right. Turns out he was in heat stroke. His temperature was 105. He was extremely confused. He was in kidney failure, very dehydrated. Exactly. He had to, be admitted to the hospital. It can be very serious. Heat stroke can be deadly.
Oh gosh. Okay, well then let's start there and talk about the differences then between heat stroke and heat exhaustion. Exhaustion being kind of the first step towards that.
It is. You may start having some heat cramps. It's all a continuum of heat-related illnesses. Okay. So with heat exhaustion, you're still able to sweat, but you are losing electrolytes, like I said, and you're losing a lot of water, and you often get dehydrated. So you might have excessive thirst, you might have some palpitations, heart feels like it's racing, nausea, dizziness, just not feeling well at all.
Okay. How do you know when just going inside into the AC, maybe in front of a fan, how do you know when that's just not enough and we do need to come see you?
You know what? If you go inside and you start to replace your fluids, you start drinking, don't drink alcohol or caffeine because they tend to dehydrate you. If you start to drink something and you're cooling yourself down, whether it's with the AC, a fan, a cool shower, and you still don't feel well, it's time to get to the emergency room because something more serious can be going on. Also, if somebody is acting extremely confused, very lethargic, or if they're unconscious, you need to come in because that could be heat stroke. And with these patients, like I said, temperature over 104, it can lead to seizures, coma. It's very serious.
Well, thank you for coming by because we're not even into August yet, so we know the heat will be back. Oh, be careful. Remember, you can find more from HCA Midwest Health on our website. Just visit kctv5.com/HCA Midwest.